Hi, my name is Liana Turdatian and I am a Seneca student. I am scanning the room 360 degrees and I will do a pain, neuro and respiratory assessment. My client's temperature is 103.5 Fahrenheit, which is high, has fever. The heart rate is 115, tachycardia, it's abnormal. Resp rate is 22, it's normal. Blood pressure is 115/70, which is also normal. Do you have any headache, pain?
Yes, I have a headache and my neck is really stiff.
When did it start?
1 day ago, but it's worse today.
What's making it worse?
Movement and light.
What's making it better?
Falling asleep.
What's the quality of pain?
It's throbbing.
What's the region? Where does it hurt exactly?
All over my head.
Does it spread anywhere?
No, it doesn't spread. I just feel very fatigued and tired.
In the score of severity from 0, no pain, to 10, bearable pain, how much does it hurt?
It's 8 out of 10 at its worst.
The treatment received?
I took Tylenol and Advil.
Was that effective?
No, it didn't work.
So what's your understanding of pain?
I don't know, I just feel so sick.
So did you have any head injury?
No.
Any seizures?
No.
Any tremors?
No.
Any numbness of fingers and toes?
No.
Any dizziness?
Yes, I feel dizzy and it's making me nauseous.
Any the weakness?
Yes, I feel very weak.
Any trouble with swallowing, speaking?
No.
Any shortness of breath?
No.
Any pain with breathing?
No. Not really.
Do you have any cough?
Yes, but it's not too bad.
Is it with secretion?
No.
Okay, so what medication are you taking?
Insulin.
Are you allergic?
Yes, to penicillin.
Do you smoke?
No.
Drink alcohol?
Mm-mm.
The patient has a headache, severe, and requires some nursing intervention. It should be providing with room, darken lights in the room, and no noise. Also pillows for support neck and head. Patient is alert, behaving good, normal, no. The patient is oriented. What's your name?
SS.
Where are you now?
In a hospital.
Do you know date?
June 12th.
So oriented to 3. The patient's gait is normal, coordinated, movement are symmetrical, no weakness observed, no tremors. The lip cyanosis is absent. The breathing breathing work is quite regular, 22 reps per minute, and no labor, no accessory muscles are participating in breathing. There is no obvious respiratory distress noticed, no shortness of breath. I'm checking the Glasgow scale, which is 15, because patient eye opening is spontaneous and oriented to 3 and obeying commands. So I am checking the pupils, parallel inspection. Neurological has round pupils on both sides, equal, and size is 3 millimeters. The pupil are reacting to direct and indirect light. So can you grip my fingers? Both hands are same muscle strength and normal. push against my hands. Both legs muscle strength is equal and is normal. The patient I'm checking the neck, there is some neutral rigidity. I am checking the lungs anteriorly in 5 points on both sides from top to bottom and in Z shape. Then on back 9 points from top to bottom, again in Z shape, and there is diminished vesicular breath sound and multiple wheezing in both lungs. As situation, patient is 17-year-old male SS who came with the main complaint of headache and cough. B background, has type 1 diabetes mellitus, which is not well controlled, and there is neck stiffness, dizziness, weakness, and fever as symptoms. A assessment: abnormal heart rate, tachycardia, and temperature, fever of 103.5. Otherwise, found the next rigidity, neutral rigidity, and sounds, wheezing sounds in both lungs. Also, there is diminished vesicular sounds. So our recommendations is comfort measures provided for headache, and further MD or MP assessment required. In my opinion, the patient has meningitis and also respiratory infection. It's for meningitis, it's a headache, stiffness of neck, neutral rigidity, and fever. For respiratory infection, might be TB or COVID, it's cough and wheezing sounds, diminished breath sound, vesicular breath sounds in both lungs, and fever. The nursing assessment first is isolation, droplet plus contact isolation to stop spreading infection. Also swab test for PCR for COVID-19, and doctor's orders will be the chest X-ray for respiratory infection, and obtaining lumbar order for lumbar puncture for CSF fluid to find the microbes and inflammation. Also, the blood test should be done.